DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're having a great show. Dr. Deana Hardee is going to be with us today, and we're going to talk about bovine respiratory disease from prevention to treatment. It's going to be a great show. Stay tuned. Dr. Dan here. Welcome to DocTalk Season of Giving with Merck Animal Health. This week, we're going to give away the new All-Flex Tagger. Now, this tagger is built to have 30% less force needed to put the tags in the cattle's ear. It's a great, great new tagging system. Now, how do I win this? You're going to go on our website, www.doctalktv.com. Just click Season of Giving, register for our newsletter, and you'll automatically be entered to win this prize. And if you win this tagger, guess what? We're going to throw in a DocTalk cap with it. Thanks for watching the show, and we'll see you down the road.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodiris, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and I'm here with Dr. Deana Hardee. And Dr. Hardee is a veterinarian. She's a technical services veterinarian and manager for Merck Animal Health. She works and within the beef industry, within cow-calf, feedlot, stocker, all facets, and she's all around this country. And so to get her here and spend some time with us, we're very thankful.
No, thank you for having me, Dr. Thompson. Excited and looking forward to today's show.
You bet. So we're going to talk about bovine respiratory disease, and it's a big issue.
Mm-hmm. No, certainly BRD or bovine respiratory disease, as you said, it's complex. It's multifactorial and it's expensive. It costs our industry a lot of money each year. And as you alluded to, really all segments of the industry are affected by BRD.
Yeah. And so help us set up kind of like, because we're going to talk about prevention and treatment of BRD, but kind of set up how the disease progresses.
No, so when I think about BRD, I kind of start with what we formally call the epidemiologic triangle. But really, it's a Venn diagram that you have to consider certain animal factors, certain environmental factors, and then the pathogens or the bugs that are involved with BRD. So I kind of break that down a little bit. When I think about the animals, each animal is a little bit different, kind of like people. If an animal is immunocompromised, meaning maybe their immune system's not mature, maybe they didn't get great colostrum, maybe they have a comorbidity or another disease process going on, that can certainly affect their risk for BRD. Maybe that animal's heavily parasitized, has additional stressors that the rest of the group might not have. Nutritionally, you got to be sound, and even like mineral status. So you kind of have to consider all of those animal factors when you think about BRD. I think the other or kind of pillar of that is the environment, right? And so there's a lot of things in the environment we can't control, extreme droughts, blizzards, etc. But there's some things from the environment of that animal that we can. Right. So good husbandry management, how we handle those animals. We understand in our production system, right, we're going to wean a calf. And that's a stressful event. But the difference in an abrupt wean and something that's a little more planned, I think can be a very significant factor in that animal's risk for BRD. And then really the third pillar or idea with this triangle, again, is the pathogens and those bugs that cause BRD. And this is what's so challenging, right, is they can be both viral, kind of like with humans, a common cold, or bacterial. And so when we think about those bacterial pathogens specifically, a lot of those live in the upper respiratory tract and cause no issues. Right. So we call those commensal organisms. They're just waiting for an opportunity, making them opportunistic, to reach down and just wreak havoc in the lower respiratory tract and really settling in and causing BRD. So thinking about all of those together, we really have to manage BRD and understand that it's probably a little bit more complicated than just a simple cold or sniffle in a calf.
Right, right. And I think that's the reason why we call it a complex, right?
Exactly, exactly.
And so anything that's going to cause stress or decrease the immune system is going to set up. And if we don't prepare those calves, both immunologically or management-wise, we're just asking for trouble.
Exactly, exactly.
Cool. It's going to be a great topic. We're going to talk about things you can do at the ranch, things we do on arrival, and things we can do for treatment. We have Dr. Deana Hardee with us today. Thanks for joining us on DocTalk, and we'll be right back.
This cattle intel is brought to you by Neogen.
When giving injections to cattle, selection of the proper needle is important. In doing so, you must consider the route of administration and the size of the animal. The route of administration will determine the length of the needle. The routes of administration will either be subcutaneous, intermuscular, or intravenous. You will determine that route of administration by properly reading the label of the product. A shorter needle will be used for subcutaneous injections, and a longer needle will be utilized for intermuscular and intravenous injections. When selecting the proper size of the needle based on diameter or gauge, smaller diameter needles will be utilized for smaller animals and larger diameter needles for larger animals, but understanding that a larger number in gauge equates to a smaller diameter needle.
Thanks for watching Cattle Intel by Neogen.
I'm Jeremy McBride. I manage the ranch for Wilmoth's here in Southwest Missouri. Probably the biggest challenges in Southwest Missouri is the weather. That's where the therapies has helped us. The last day we got through weaning, it was 65 degrees and sunshine. And the very next day it dropped to 35 degrees, rained 2.5 inches, which is very, very hard on these cattle. And we doctored 2 head.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson with Dr. Deana Hardee, and we're here at Merck Animal Health in Lenexa, Kansas, where Dr. Hardee serves as a technical services veterinarian, and she is a veterinarian for beef cattle of all segments of our industry. And you're going to see that today as we talk about this BRD complex, stretching from cow-calf to feeder. But Dr. Deana, when we're at the ranch, there are things we can do to help prevent BRD, correct?
Without a doubt. And we talk about herd health and a herd health plan being so critically important, and don't want to miss any of those aspects of the herd health plan. But today, I think we really need to talk about a vaccine strategy, again, being one pillar of that entire plan. And at the cow-calf level, I think we really have the opportunity to set a calf up for success, not only there, but in future production cycles by having a solid vaccine protocol.
What are some of your core principles or thoughts on that?
I like to keep it pretty simple, Dr. Dan. So I like to see, if possible, what we call a branding age, 2 to 3 month age calf receive a respiratory and a clostridial vaccine.
Yep.
We know that mom's maternal antibodies are so critically important for a calf, and they're starting to wane at about that age period. So vaccinating then allows that calf to boost its own immune response. The other side of that is some sort of pre-weaning or weaning vaccine. And I always call it a good quality round of vaccines. I don't mean vaccinating the calf as it's rolling onto the truck.
Yep.
But again, respiratory and clostridial, keeping it pretty simple. I should probably circle back though and mention, if we're talking at the cow-calf level, we can't forget to vaccinate the cow, right?
Yeah, absolutely. And, vaccinating the cow and taking care of the parasites in the cow are all things that just bring more milk production and
Exactly.
for the calf.
And good quality colostrum, because that calf's born so naive and it depends on mom's colostrum for that initial immune response. It's really important that cow be vaccinated too.
Yep, and then we think about the success of having those cows bred in that first cycle versus second cycle and third cycle, that our vaccinations are helping, decreasing parasitism's helping, which then gives us even healthier calves, right?
Without a doubt. And I don't know about you, but in the business model where I sell pounds of calf, I sure like having those calves on the ground sooner rather than later as well. So
Absolutely.
I think we see an ROI both on just pounds of beef weaned and then also from a health standpoint too.
What about management size? Like should we have them on feed? Should we break them to the water tank? Should they understand that before they're shipped off?
In a perfect world, that would be ideal, right? If you think about, again, our production system is a little bit stressful. That animal is going to move, often traveling far, right? Yep. So if we can make them as comfortable as possible by introducing them to some sort of water tank or trough, not just the pond, creek bed, etc. If we could maybe get a bunk in front of them, even a trough, so they've had access to grain feed. And understanding that's not always realistic, but I think any little thing we can do like that, you're exactly right. Those husbandry management practices will truly set that calf up for success in the future.
Yep. Great points. Reducing stress, increasing familiarity, helping those calves transition from the ranch, having them immunologically sound.
Yep.
All are great prevention tools for making sure that we prevent BRD when they get to the feed yard. You're watching DocTalk, Dr. Deana Hardee, Merck Animal Health. We'll be right back after these messages.
Founded by farmers, for farmers, United Patriot Coin stands with you. Diversify your financial portfolio with precious metals, a smart investment for uncertain times. You've worked too hard not to protect your assets. United Patriot Coin, precious metals for a secure future.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Deana Hardee. And Dr. Hardee is a veterinarian. She is a technical services vet for Merck Animal Health. And if you get an opportunity to go to one of her talks, you should. She is a tremendous speaker and full of information. We have had her at our PAC summits for our clients, for our veterinarians, and somebody that is really doing good in the industry. When we talk about prevention after arrival or preconditioning vaccines or what have you, vaccines are core to our health platform, but they might not have the same goals as what everybody thinks they are, right?
No, you're exactly spot on. Vaccines aren't bulletproof. They are not a magic solution in a bottle, unfortunately. Do we wish we had something like that? You betcha. But really, when I think about a vaccine and the goal of vaccine, it's to try to protect an animal during a time of susceptibility or when there's a gap or an initial stressor. I think the other goal that we really need to think about too is a vaccine should reduce the duration, severity, and potential shedding of whatever disease or pathogen we're worried about. And really, when we vaccinate, and in my mind, in the beef cattle industry, it's to protect that animal as it moves through the different segments of the industry as well.
Yeah, I mean, we're adding cattle on at sale barns. We're adding cattle on at at the feed yard after arrival, because not all pens are the same size.
Right.
And then they're being exposed as they come through the hospital and doctoring and processing areas. So there's just so many times that it's kind of like when your kid goes into the doctor's office for the well check, and there's the kids that are in there for the sick check.
Yeah, no, you're exactly right. It's eerily similar to moving a child into kindergarten or the first time they've been exposed to pathogens, for sure.
Absolutely. So what are some of the other things that when we're talking about during that processing procedure or post-arrival at the feed yard, what are some of the things in that processing barn that you think about as far as prevention of disease or control?
Probably already mentioned this, Dr. Dan, but again, anytime we have the opportunity to reduce or mitigate stress, I think that's so critically important. That's simple things like when you receive a calf, have a plan, make sure there's adequate amounts of fresh water. If you have a history on the calves and know maybe they haven't seen a water trough before or a float type tank, maybe that's adding some water in the pen. Haying calves, I know different areas have different opinions on that, but just have a plan and understand the type of calf you're receiving so that, again, you can reduce that stress on them when they get there. I can't iterate how important animal husbandry is in this BRD complex. Arguably, it might be more important or as important as getting that vaccine in the calf.
Cattle handling.
Oh, without a doubt. Anytime that you can reduce stress there, I think we have been doing the same things over and over, and I often get frustrated walking into processing barns where if they've received maybe a calf from Florida, they try to handle it the same way maybe they have received a ranch calf or even one of our beef dairy crosses, and we know all three of those calves are going to work a little bit differently, and we have to respond a little bit differently to that.
Yep. So having an awareness, having a place for receiving calves that's comfortable, get them hydrated, handle them correctly is all important.
All right, and we can argue and go back and forth all day on how many days do you wait before you vaccinate. Is it hours? Is it right off the truck, et cetera? But I really think you just hit the nail on the head when you said hydration. And that's why I tell folks it probably depends on lots of factors. But if I can make sure an animal's hydrated before I work them, I think that goes a long way.
Yep. Absolutely. We're on complete agreement. We're going to come back and we'll talk about detection and treatment of BRD. You're watching DocTalk.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to BimetaBiologicals.com to learn more.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/DocTalk.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. Deana Hardee. We are at Merck Animal Health, where Dr. Hardee serves as a technical services veterinarian. You know, when we're talking about prevention and treatment of BRD, the one that's kind of in between is the metaphylaxis or the mass treatment at initial processing.
No, certainly. I think metaphylaxis or mass medication is so critically important, especially in a certain class of cattle. I know, though, we do have to be strategic and judicious when we use metaphylaxis.
Yep.
And I think another challenge for me, too, is to tell people to understand their post-metaphylactic intervals, depending on what drug they're using, and sticking with that. So the time when they arrive and they receive that antibiotic, and then when you decide to treat again.
Yeah.
One of my favorite things to say is you can't manage what you don't measure.
Yep.
And certainly as we think about metaphylaxis, being very important in that, both not only controlling but also reducing the incidence of BRD. I hope we have the ability to continue to do that for years to come, but I think we have to, again, be very judicious when we think about metaphylaxis.
You bet. So, you know, let's move from the processing barn to calves in the home pen. And how important is it for early detection of bovine respiratory disease and like treatment outcome?
Well, in terms of early detection, we know BRD is hard to find. Cattle are naturally animals that are going to hide illness. I always joke, riding in the feed truck, I could detect BRD better than being in the pen, because that animal's instinct, right, is to act normal.
Yep.
Be like the rest of the group.
Yep.
And so not only do we have to find the cattle, and again, that is challenging in itself, but we hope we can find them earlier in that disease process. Cattle are great, and I know you know this, Dr. Dan, at walling off infection in their lungs.
Mm-hmm.
And so it just makes this whole complex very confusing, because now we have an animal that doesn't want to tell us they're sick.
Yep.
Their immune system is working overtime, and maybe we're behind the 8 ball when we give that treatment drug. So really the goal is to be ahead of BRD, and that's where prevention comes into play. Of course, treatment often has to be elicited at some point. And so again, trying to find that calf in as early as possible sure is important.
Yep. So then we once we find the calf, now it's, I assume, you know, going through like a physical exam and using the right treatment or using what the veterinarian prescribes, correct?
Without a doubt. And that's where visiting with your local vet and understanding and having a solid treatment protocol is so important. Again, sticking with that protocol. So, you know, if those cattle received metaphylaxis, what's the first treatment drug? And that's probably going to change if a calf maybe didn't receive metaphylaxis. So again, following all of those time intervals between when you gave one product to the next, and then sticking with products, because again, that's how you tell if what you're doing is working.
Yep.
And if you don't stick with those protocols, it's really hard to go back and retrospectively say, hey, maybe I should swap something up. So I always really encourage folks to, again, work with their local vet and have a protocol and stick with it.
Yeah, I do the same thing. If I want to sort out source of calves that I buy or management procedures that we're doing, which are really the big ticket items, in my opinion,
Mm-hmm.
Versus which, you know, miracle mycin versus whatever hope and a dream mycin. But you know, that's how we can sort these out better, right?
Without a doubt. Without a doubt.
Well, I appreciate you being on the show.
No, thank you, Dr. Dan. Appreciate it as
It's
well.
always great to have Dr. Deana Hardee with us. Remember, if you want to locate us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson with Dr. Deana Hardee, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Dr. Dan here. Welcome to DocTalk Season of Giving with Merck Animal Health. This week, we're going to give away the new All-Flex Tagger. Now, this tagger is built to have 30% less force needed to put the tags in the cattle's ear. It's a great, great new tagging system. Now, how do I win this? You're going to go on our website, www.doctalktv.com. Just click Season of Giving, register for our newsletter, and you'll automatically be entered to win this prize. And if you win this tagger, guess what? We're going to throw in a DocTalk cap with it. Thanks for watching the show, and we'll see you down the road.